No criticism is already pouring in from the left. Nancy Pelosi hammering on this budget proposal. She says the budget's a statement of values. And once again, the president showing just how little he values the good health, financial security and well-being of our hardworking American families. Less than a week after promising to protect families' health care in his State of the Union address, the president is now brazenly inflicting savage multi-billion-dollar cuts to Medicare and Medicaid. Also pointing out foreign aid being cut by 21%. The EPA would face a 26% reduction in funding, and also cuts to the Department of Housing and Urban Development, 15% cuts there. How do you respond to that criticism?
As it pertains to Medicare and Medicaid, her accusations are totally false. Medicare will grow by 6%, Medicaid will grow by 3%, and we propose reforms that are good government, things like reducing the cost of prescription drug benefits. That's $135 billion. It's something that Democrats have said they're interested in doing it. The president's been very clear. There will be no changes to the benefits of Social Security and Medicare, and this budget complies with that promise to the American people.
Mr. Director, you know the president did an interview in Davos where he talked about entitlement cuts, whether it be in the short term or in a potential second term in office. That raised some alarm bells on the left. Now you're saying, look, there's not going to be any cuts to entitlement programs that the president himself teed up might be coming. Which one is it?
The president has been completely frank with the American people. There will be no cuts to Social Security and Medicare beneficiaries. He's reiterated that this weekend. This budget complies with that promise. There are changes to mandatory programs that achieve savings that are good government reforms. When we can lower the cost of a CAT scan in Medicare, or lower the cost of prescription drugs, or have people get back to work via a work requirement in Medicaid, or housing programs, or TANF, those are things that achieve savings for taxpayer and help beneficiaries get back to work.